All right. It looks like we have about half the people that we expect here today. So we're just going to go ahead and get started. We have a very rich conversation today, and I would love to just jump right in. Again, thank you so much for joining us. My name is Elizabeth Roman. I'm the President and CEO of the Women's Funding Network. I'm really excited to have you all with us today for this very exciting conversation. Let me go ahead and introduce my panelists here, which we're very thrilled to be joining us here. First, we have Ipas President and CEO, Kumar. Thank you so much for joining us. We also have with us Christian Minter from Ivy Black Girl, and she's a maternal health organizer. Thank you, Christian, also for joining us today. So we'll be leaving time for questions and answers. Please use the Q&A function in your chat for questions. As we proceed, we're going to join in a conversation with our wonderful panelists here, talking about some of the top of the questions that you've actually introduced in some of the in the registration, and then we'll be. But again, as this conversation continues to go, please continue to add your questions into the question and answer function within the webinar. You can also feel free to add thoughts to the chat. We'll be monitoring that as well. And again, welcome, and we're so excited to have you all here today. Excellent. So just to get started, reproductive health and rights, reproductive justice. Again, we're so glad to be having this conversation. As women's funds and gender justice funders, we know that the right to parent and the idea around control of a reproductive autonomy is a huge piece of what it looks like to have gender equity in the world. And so we're excited to have this conversation about how it relates to your organizations and how you're introducing the subject. First, let's get a little introduction. Anu, would you get us started with just a bit of an introduction about who you are and a little bit about what Ipas does?
Sure. Thank you so much. And thank you, Elizabeth, and thank you to the Women's Funding Network for having me and for hosting this really important conversation. And I really look forward to the discussion that we have as a community. So Ipas is an international reproductive justice organization, and I am president and CEO of the organization and have been for the last 3 years. So I've been with the organization for nearly 20 years now. Ipas has been in existence for nearly 50 years, and we believe that everyone has the right to determine their own future, and particularly the reproductive future. We work across Africa, Asia, Latin America. We have partners and programs that work to make abortion and contraception widely available and to connect women to the vital information that they need in order to be able to access safe abortion services and care. Ipas is the only international organization that focuses on expanding access to abortion and contraception together. Why do we do this? It's because we believe that people don't have the ability to make fundamental decisions about their own bodies and health, that if they don't have that ability, then they can't fully enjoy the human rights to which all people are entitled. So we very much see abortion, reproductive health, and contraception as part of this broader array of human rights that all people are entitled to. So I'll just stop there, and I'm sure we'll dive deeper into that.
Excellent. Thank you so much, Anu. And just for the audience, we have both Anu and Christian's illustrious bios also listed on our website, and we'll be following up with that as well. Again, it's quite amazing all the work that you've been doing and the career you've had at Ipas, and also Christian with your work as well. Again, would you mind, Christian, go to you. Would you mind introducing yourself and talking a little bit about what the work you do at Ivy Black Girl?
Yes, thank you also for including me in this event. So I've been involved with Ivy Black Girl for about a year with the Black Maternal Health Advocacy Campaign. And Ivy Black Girl is a collective that creates space for Black women, femmes, and girls to access our full potential. And they take 4 different approaches to this. So advocacy is one part, but we also have our give work with collective giving and volunteering grow work which focuses on economic liberation through entrepreneurship and connecting that affirms and uplifts Black women, femmes, and girls in our community. And then our advocacy is where our Black maternal health work falls under. And so we take a deep dive in several issues, with Black maternal health being one of those. And so within the last year, we formed Nebraska's first Black maternal health coalition. And we've been involved with public policy, community awareness, and some other projects that I can talk more about later. Thank you.
Thank you, Kristen. And again, so important to have that your work represented in Nebraska, which is, it's you hear a lot of these the challenges to reproductive health and rights. A lot of it is happening in the Midwest and in Texas and these places. So again, it's really important work that you're doing there. So why don't we just go ahead and jump right in? I think the number one thing that people are thinking about is what is reproductive justice? What is reproductive justice? How would you define it? What's the difference between that and reproductive rights? Maybe just start there. And Kristen, would you like to start us off?
Sure. So I use the definition established by Sister Song that reproductive justice is the human right to maintain personal bodily autonomy, to have children or not have the children, and to parent children in safe and sustainable communities. And so in the context of maternal health, that includes like having equitable, respectful, and culturally relevant healthcare, all the way from preconception through the postpartum period, having access to different birth options and settings, and then the academic security to actually support the families that we want to have, and to address all the reproductive needs that we have, and have safe neighborhoods and things like that. And I think the difference between reproductive rights is understanding is more of like an individual and legal rights, and reproductive justice takes a more holistic view on all the different factors that impact reproductive health. So we know that having the legal right doesn't always translate to having equitable and meaningful access to services and resources. So that's where the justice piece comes in.
Thank you. Anu, how would you respond to that question?
Yeah, no, I think Kristen is absolutely right in drawing on that Sister Song definition. Interestingly, I was part of the initial conceptualization of the reproductive justice framework, because that actually grew out of an experience that the activists Loretta Ross, Daison Dixon, and others had while thinking about the human rights framework, the Universal Declaration of Human Rights framework, when they were doing work, particularly in South Africa and in the African context, and realizing that the Universal Declaration of Human Rights, which is a very powerful document, but has seldom really been applied to the United States. And they took it and thought about it from the point of view of African-American women, of Black women and brown women living in the US, and expanded it, as Kristen said, and really made the very important, I think, linkages that, yes, Ipas, for example, as an organization, we are focused on abortion and access to safe abortion, but we very much think of this as linked to these broader issues, these broader socio-political, cultural, economic issues and systems that constrain individual action. And so I think the real contribution of reproductive justice movement, framework, and thinking is to help us lift and think about the individual in this broader context. And to think about all the gates, the gatekeepers, the barriers that prevent true equitable existence, frankly. But as applied to, very particular issues, as Kristen was mentioning, Black maternal health, one of the reasons we work on abortion is because abortion is a leading cause of maternal mortality. It's one of the 5 causes of maternal mortality around the world, the one that's most preventable, and has been prevented. Women fortunately do not die of abortion-related causes in Europe or in the United States, but they do die. of abortion-related causes in Africa, in South Asia, and in other parts of the world. And that happens to be because of the economic and political and social constraints in which they're living under. So it is very much, thinking about these issues and linking them back up to bigger, broader issues, even issues such as civil rights, political rights, and looking at it from a really holistic point of view, which I think is the really most powerful contribution of this framework is, not the individual, neither to blame the individual, nor to say it's your fault, nor is it to say, is it your responsibility? It's our collective responsibility. And that collective action, I think, is what's really powerful about this framework.
Thank you so much. I think that is something that people are often confused by, why it's not just another word, it's an additional context to this. And one of the things that we see often is even thinking about how pregnancy itself can be something that even especially in the U.S., particularly for women of color, is a leading cause also of maternal death. And again, the ability to be able to have some choices about that and safe and legal abortion, as well as other pieces, is a crucial piece of that. But again, that economic context and the justice context is extremely important as well. I guess that's where, I would love to hear more. I mean, this is a big, you think about, anytime you add justice to the end of an issue, you're thinking very broad and all of the different interlocking pieces, which is what women's funds do in terms of their support. They think about all the interlocking pieces that get at the root cause of a particular issue and attempt to resource it and move policy in that direction as well, and support organizations working on the ground that are working to get at those root causes. I just want to explore a little bit more about your organizations. We heard about what they do, kind of their mission statement, but maybe talk a little bit about how the approach that each one of your organizations take at addressing both the broad pieces around reproductive rights, health, and justice, and the more specific things you're working on to advance this issue. Anu, would you like to take that?
Sure, thank you so much. Yeah, so just to say a little bit more about how we approach this issue, yes. So we focus on the needs and perspectives of those who seek abortion care, where we take a very comprehensive approach to this. And we address the multiple factors that go into a person's ability to access abortion. So everything from the individual knowledge about reproductive health and physiology, and how to get an abortion, and then what the methods are of abortion, safe abortions, to community and social support. We train health workers and health providers on how to provide abortions. And we also work to change the political and policy environments in which we're active. And so all of these things are part of our comprehensive approach. And we're looking at it very much through a systemic lens, and working from local to global levels to make an impact. I want to mention that we have 17 offices around the world, and those offices are actually staffed by local nationals. So that's really important, because we take the systems point of view in our work, we really want and need people who understand their local systems. And so, to us, abortion is healthcare, and it is a human right. And we know that there are gender, racial, and economic inequities in the healthcare systems around the world that make it really difficult for women, especially women of color, LGBTQ people, and other marginalized groups, to really access that essential healthcare. And so we are looking and trying to look at these intersectional and related issues, and taking like I said, a very comprehensive approach so that all people can access services and care when they need them. Most of the countries where we work are low to middle income countries, and the people that we serve are often quite marginalized and face multiple barriers. So for example, Our team in Bolivia works quite a lot with indigenous women's organizations and advocate with them and on their behalf and with them on sexual and reproductive health care. In Nepal, we have worked with factory workers to provide accurate information on health services and abortion to them. In Kenya and in many other places, we work with local groups to increase access to comprehensive sexuality education, which is a huge barrier and need. And we're working to, increase that knowledge amongst young people in particular, but all people, frankly. And then another example would be our work in Bangladesh, where we have been working with the Rohingya refugees, who fled Myanmar almost, I think, 3 years ago now. There's almost a million, close to 1 million of them living now in Bangladesh, a very large concentration of Rohingya refugees. And they are in grave need of abortion care and contraceptive care. And let me just mention real quickly that provision of abortion care to the Rohingya refugees in Bangladesh was the first time ever that abortion was provided in an acute crisis setting. And so, that was a huge, gain, but we're trying to make sure that the refugee population gets the services and care that they need, and B, that they are, thought of as individuals, as people who have the right to this care. Unfortunately, we're seeing this happen again right now in Ethiopia, in the Tigray region, where sexual violence is being used as a weapon of war. And we're again working to bring reproductive health care to people in these crisis settings. So I think with these examples, you might be able to tell a little bit about how we work, which is primarily through partnerships and really looking at the most vulnerable, the most marginalized groups, because they're the ones that are not able to access the care they need. I mean, no matter where you go in the world, whether you're in Nebraska or whether you're in Nepal, rich women will find what they need. We have to really think about the poor women and the women, and who are they? There's not just a blanket category, but who are they and what do they need? And that's what we're focused on.
Thank you so much. Kristen, same question. If you could talk a little bit about the Ivy Black Girl and the work you do kind of more broadly around the reproductive justice and some of the more specific fights that you all are working on.
Sure. So as I mentioned, we formed a Black Maternal Health Coalition. As part of that coalition work, we are collaborating with different organizations, state level, community level organizations that are involved in some way with maternal health and Black maternal health specifically. We are not a direct service provider, but we look at ourselves as a convener and an intermediary in bringing the resources to the community. So as part of that coalition, we have been given some feedback to new policies that have been introduced in state legislation. And so giving the perspective of centering the experiences of Black women in Nebraska and how these policies would impact us. And so some of the issues that we're seeing, for example, in Nebraska, is that we're really lacking in the data that can tell us the specifics of where we are with Black maternal mortality and morbidity. So we've really been advocating with our state senators and with other organizations about what that data collection should look like, how should people be represented on our state maternal mortality review committee so that we have a more diverse and inclusive representation in collecting and reviewing and assessing that data. We also involved in doing a power and asset map so that we have an idea of what are our resources, how can we leverage the power and influence that we already have here in Nebraska, and also connecting nationally with other efforts going on around the country. And then we also done some community education as well. So we've done some webinars and other events. We've also done some training specifically for our state legislators, educating them on the impact of systemic racism. Because we know that with Black maternal health outcomes, it's not just about education and whether or not they are living in poverty, but a lot of it is their lived experiences as a Black person in the US. And so understanding the historic and the current impact of systemic racism and how that influences maternal health. And legislators need to understand this because they're making laws for things that they may not be involved in on a day-to-day basis. And so I'm just making sure they understand our perspective and the experiences of the women in our state. So that's some of what we've been doing recently.
Thank you for that. And Christian, I just to mention also that you're a medical librarian and health literacy advocate. So the idea around the data, I think, is just really germinated. And I love that you're coming from that perspective as well. It's kind of the history of where medical practice meets kind of the real world, and putting that into the work that you do. So I'd like to talk a little bit more about some of the, again, very different in terms of the platforms that you're working on, but some of and I think also in this moment, I know we've just passed 4 years where things are just continually getting worse on this issue, but we're approaching a moment where there's a bit of a dichotomy, it seems. There's, on the one hand, there's some positive notes internationally around like the Hyde Amendment and other pieces that the Biden administration has been aligned with advocates, and then what's happening domestically, abortion bans in many of the states, what happened in Texas recently. So there seems to be a bit of a dichotomy in terms of direction and how this issue is progressing. What do you think that signals for the future in terms of what's happening domestically around abortion care and reproductive justice, seeming to still be a fight that is, if not progressing, but there's pieces where it seems like we're moving backwards a bit. And then internationally, there seems to be some lines of hope and some lines where things are in fact progressing. Thoughts about what that means and what that signals? Annie, would you like to jump us over?
Yeah. Well, I think it's really important to remember that the United States is part of the planet, and that it is, not isolated and alone and unique. And so when we talk about reproductive justice and we look at the progress that's been made, I think we should all be aware that there has been tremendous progress. Over the last 40 years, last 25 years, and I use 25 years as the marker because it was the marker, the time of a very important international conference, the International Conference on Population and Development, which took place in Cairo. And since that time, we have seen 40 countries liberalize their abortion laws around the world. I think Americans rightfully feel often depressed about the state of abortion access and laws in the US. But I guess I want to say that the rest of the world, it has moved on and is moving on. And so we have seen the liberalization of abortion in places like Nepal, Ethiopia, South Africa, Argentina, Mexico City, the DRC, places that are considered conservative and yet have taken on this issue because they see it as part of healthcare. They see it as part of, human rights. They see it as really important and critical for the lives of their women and girls, because it is. Yes, we have seen tremendous progress, globally, and we're even continuing to see it today. In fact, I should mention that the Hyde Amendment, as you mentioned, is the U.S. domestic version of something that occurs globally, which is called the Helms Amendment. These are both restrictions on U.S. government funds and whether they can be used for abortion care. The Helms Amendment, which has been in place now for 50 years, really as long as Ipas has been around, is part of the U.S. Foreign Assistance Act. And it has said that no U.S. government funds can be used for abortion care, and it's been interpreted as a total ban on any use of U.S. government funds for any kind of work overseas. Well, this is a big deal because the U.S. government is a major funder, the largest funder of reproductive health programming in the world. And none of that work, none of that programming, none of those millions of dollars has been used for abortion care. Today, or actually on Friday, I'm feeling really optimistic because for the first time, Helms was omitted from the House Appropriations Bill. which is the first time that that's happened. And as you noted, Elizabeth, Hyde was also omitted, so not included in that. And so this is, and also the bill calls for a full repeal for the global gag rule. And we are definitely seeing progress. So I guess I would say that from my point of view, and I have been doing this now for quite some time, I am not as pessimistic. I think we are seeing real progress globally. I think what we're going to see in the United States, and my colleagues certainly in the reproductive justice movement here, are pointing to a patchwork of legal regimes that will allow women to access care. But I want to make this final point, which is that abortion has been part of women's lives for thousands of years. It is not new. It is not going away. Women have always done what they needed to do to end a pregnancy that they did not want. And women are doing it today in the United States of America by accessing medical abortion pills. These pills can be taken privately. They can be taken at home. They do not require a provider. And that is where I think we are headed. Now, would I like legal abortion? Yes, I absolutely would, because I think it speaks to the values of a society, and it speaks to the values of a community. And it is clear that the United States is still really split on this. And we have not made the determination that we actually fully, completely value the lives of women and girls. But the rest of the world has. And the rest of the world is really not turning to the US very much any longer for that kind of leadership. Delighted to see the Biden administration now kind of join the fold and be a much more active participant in that. But the Trump years cost us. They cost us a lot. They cost us a lot in our leadership and our moral authority. And it's going to take a lot more than 6 months to make that up.
Thank you. Thank you for that. Kristen, what are you seeing on the ground where you're at?
Yeah, so I think when looking at reproductive health through the lens of Black maternal health, nationally, we have had documented data that shows disparities in maternal health outcomes for over 100 years. So there's definitely been some progress, but there's still more progress needs to be made. But there's definitely been more attention paid towards maternal health outcomes and how there's a difference in the experiences of Black women, specifically in the United States. I think some of the difference has been in the past, especially in the field of public health, there's been a focus on the individual of what are those individuals' health behaviors? Do they need health education? How can we change the individuals to do better? And now public health realizes that instead of focusing on the individual, we also need to focus on the environment, changing the environment so that healthy behaviors and healthy outcomes are the default and not something that needs to be overcome. And so looking at Black maternal health, we realize that there's so many other issues that impact health, social, political, economic, race discrimination. And those types of things are not something that's easily changed overnight. We've been seeing some progress, but there still needs to be more progress made with how we develop laws and how we develop communities that are healthy, how we undo the damage that's been created by things like redlining and discrimination, education, and access to jobs and pay equity. All those things take a collaborative effort, and it also involves the changing of power structures, which is something that's not easily dismantled and restructured. So I'm hopeful, but I definitely see where the U.S. and also here in Nebraska, where there's still change to be made. So some of the things that we're advocating for in Nebraska specifically is paid family leave, a living wage, a higher minimum wage in Nebraska, for data, better collection and sharing of data, holding healthcare systems accountable for our outcomes. So there's definitely room for improvement, but there's definitely here in Nebraska, we're building that coalition so that we can work together and have less of a silo of different individuals and groups trying to do it by themselves.
Excellent. Thank you for that. I think this is a good segue to this idea around how is reproductive justice and health connected to gender justice and gender equality. And it seems like you've definitely touched on some of those intersecting issues that impact both kind of movements. Christian, would you talk a little bit more about what your thoughts are around how gender justice and equality fits in or is a part of the work that you do?
Sure. So gender justice in general seeks to eliminate, sexism, transphobia, homophobia, all the systems of oppression that impact all genders. And we know that, in comparing the outcomes of women, femmes, and girls, that there are definitely some disparities that they experience that are separate from other genders. And so anyone, when we're talking about Black maternal health, oftentimes we use women, but anyone who has a uterus is experiencing these disparities. And so that can be trans men, that can be non-binary folks. And there have been a history of oppression as far as like forced sterilization, stigmas about who's a good parent, who's appropriate parent, and someone's ability to maintain care of their children after they do give birth. So there are a lot of issues that have to be overcome and addressed in achieving justice in both areas.
Thank you for that. Anu, well, what are your thoughts about, again, that kind of gender justice and inequity and how that fits in with the work you do?
Yeah, I mean, I think they're intertwined, as Christian just mentioned. And if you think about the world through this intersectional lens, you really can't have reproductive justice without gender justice, and vice versa. So I think it's really important to talk about and think about the various the movements and how they need to be connected. So certainly reproductive justice, but the racial justice movement as well, the climate justice movement. That's something that we don't talk about a lot, but I think there's also a need to link these things together and to really think about, the various forms of oppressions, as Christian was just talking about. And the flip side of oppression is power. And so, what we really need and what we really want to be talking about is how do we amass greater power among those that do not currently have it. So certainly the groups that have already been mentioned, obviously women and girls, trans people, gender non-conforming people, people of color. There's a long list actually, because power has been frankly quite concentrated, and that power needs to be distributed, much more widely distributed. And I think if we think about some of the environmental movements and the as Christian was talking about, that the environment is also hugely important, and climate change is hugely important. It impacts women and girls directly. When I was mentioning before the work that we've done with refugees, that intersection between climate-related disasters, which are increasing, and women and girls and people who are on the run and facing humanitarian crisis, they're leaving their homes, they're forced to leave their homes due to climate disasters. That's the Venn diagram of humanitarian crisis, where women and girls are in need of care, of a wide array of care, but it includes reproductive health care, it includes abortion, it includes contraception, it includes gender, support for gender-based violence, it includes lots and lots of things. And so to me, that intersection, those intersections need to be really much more further explored. But at the root of it all is power. And how do we redistribute power?
Excellent. Thank you so much. I think that leads me to another one of the questions that kind of, again, this is the audience is mainly gender justice funders, women's funds, and the idea of resources. I think we talked a little bit about the Helms and how money is flowing internationally. Resources are incredibly important in this issue. Who has it, who doesn't? You talked about rich women will always be able to figure out a way to have an abortion if that's what they need. So resources are incredibly important. I'd like to talk a little bit now into what role you think philanthropy plays currently and what the opportunities are for philanthropy to play a bigger role in advancing this issue. Christian, would you mind sharing with us some of your thoughts on that?
Sure. So from the perspective of funding work supporting Black maternal health, we need more money. There is, I saw a stat that in 2018, only 1.5% of maternal health funding went to Black-led initiatives. And this causes a lot of competition. There are small and large organizations across the US, even here in Nebraska, we have multiple nonprofits and groups that are focused on Black maternal health. And when there's such limited funding, instead of fostering collaboration, it can contribute to tension between groups because, who's going to get the money? Who's going to be able to progress in their goals? And so I would think there needs to be more funding available. But also, sometimes funders seem a little more interested in maternal health projects that focus on the clinical environment. And so while it is important to look at the quantitative data of how efforts are reducing mortality and morbidity, it's important to fund community-based organizations. It's like we've already said, reproductive justice is multi-factor, multi-discipline, effort in things that are happening outside the clinical environment. So pay equity, healthy neighborhoods, climate change, all of that impacts maternal health. And so looking at the creativity of the Black-led organizations that are already out in the community, that have the community trust, putting them, elevating their positions of power and stepping back and not trying to set goals that go against what the community says they want. Because, those who have experienced depression sometimes, often know best of what the solutions are, and the solutions are there in the community. We just need the funders to prioritize, to listen, and prioritize to what the community actually needs most.
Thank you. Anu, do you have thoughts on that?
Yeah, I do. And it's an interesting question for me because I used to work at the MacArthur Foundation. So I was on the donor side of things for quite some time. And now for the last couple of decades now, I've been on the grantee side or on the nonprofit side. So I've kind of thought about this question from multiple points of view. I think Christian is totally right that more money is necessary. That is clear. On the abortion area, I mentioned the US government, which is the largest donor in the reproductive health area, which does not support abortion. The second largest donor is the Gates Foundation. The Gates Foundation also does not support abortion. And so we have a really serious problem because donors and funders seem to be quite afraid of this topic. They're really afraid of what this might mean for them personally, what it might mean for them, in terms of their corporate giving and what might happen to their brand. And so, I think what we really need is for donors to be brave and to step up and step into this world. And not think of it in silos. And I think one of the things that Christian was just talking about and that we mentioned earlier was, the creativity that comes from working at a community level, working at the local level, means that you see all these intersections, and the ability to act on those intersections as they come up is really critical. So, for example, this climate justice work I mentioned, this came to Ipas not because we are a climate organization, but because we saw what is happening to women and girls in these places, and we connected the dots back up and back down, and realized that we need to care about climate change, that it is a gender issue, And so to me, what that speaks up to is the need for unrestricted funding. The need for the to allow the creativity to occur, to allow the connections to be made, to allow organizations to take advantage of opportunities as they come up. The legal changes that I mentioned on abortion laws around the world, well, many of those came up like that. Some of them occur very, very quickly, and you got to move and you got to be ready to move. And the time that it can take to apply for a grant is too long. Ipas has been fortunate to have some unrestricted resources, and so we've been able to take advantage of some of those opportunities. So, I think that's another really important feature for donors to really think about is it more important to them to have their deliverables or their monitoring needs met, or is it more important to them to allow the groups to really do what they think is best? And yes, you will not get a 6-monthly report with the check marks, but over time, you will see massive change. And I think that time horizon, that perspective is something that, is really important to keep in mind when you're funding these kinds of issues. Because what we're talking about at the end of the day is, frankly, massive social change, massive. In the United States, the racial justice movement has really awakened many of us to, again, to the stark realities of racial inequality in the United States. But this is true globally. Colonialism is a global phenomenon, and it has impacted global health just as much as it has impacted every other aspect of our lives. Well, colonialism has been around for easily 500 years, depending on how you count, but depending on where you are. But that's a long time. That's a long time, and we are all steeped in its ways, deeply steeped. And so, how do we undo that? Well, it's not going to be overnight. And I have to say, this is one of the main learnings for me as an individual, because by nature, I'm a very impatient person. And so I've had to kind of learn to think about things from a much longer time horizon than I would otherwise. And so anyway, I say that as, stick with it, be patient, allow your organizations to really run with their creativity and run with their, what they see, and help us and help yourselves make these connections to issues that are much bigger than the maybe somewhat small thing that you're working on. I mean, I think of abortion, frankly, as a niche issue. I get it. It's a niche issue, but I connect it back, and I see it as strongly connected to broader reproductive justice issues, maternal mortality, climate, human rights, gender justice. It's big. It's big.
Thank you for that. And much to what you described, it seems like it is a signal. It's one of those signals that the rights of women and gender is starting to shift. The power about what people can say for themselves is starting to shift. So definitely as an indicator of that. Again, it also speaks to the importance, I think, of where women's funds in particular can maybe step in, where if they're noted for doing flexible funding around the world. They're noted also for, in particular, funding both kind of at the very local level for individual needs, but also for large systemic change. So there's a lot of flexibility that women's funds are already bringing to that funder table, and gender justice funders are doing as well. So it seems like a really big opportunity to step into this void of necessary funding for reproductive health and abortion care as well. And let's see, let's go to it looks like this conversation has been so great. We want to make sure to take some questions and answers here. Looks like there's a few that have come up. The first one I'd like to address here, it says, if you could talk a little bit about incarcerated women. And I'm going to add a little bit to this question also in detention and incarceration. How does this issue intersect there, and how do you see some of those the solutions around that? Kristen?
Sure. So when it comes to maternal health and incarcerated individuals, some of the issues that have come up is how they are treated while pregnant and after birth. So one of the big issues has been, the shackling of pregnant persons, while they're pregnant, during labor and delivery, There have been some policies that have been passed in a few states related to that, but it's still an ongoing issue. And it's also another issue that has come up is separating parents from their infants after birth. Research has shown that there are health benefits for both the parent and the baby after birth by keeping together as long as possible. And so there are some places that are exploring what that looks like. How can they keep them together as long as possible? How does that increase the birthing person's ability to be successful in their life once they're released and continue their parenting journey? So I think a lot of the issues outside of incarceration are issues for those who are incarcerated, but you have that added layer of how are they treated in that environment, what those restrictions look like as far as their ability to move around and to be a parent after giving birth, and really acknowledging their humanity as well. Like that's what it boils down to. Are they being treated with dignity and in their birthing experience?
Yeah. I know.
I'm afraid I don't have much to add to that particular question, but I see one in the chat about the DRC, which I'd be happy to address if you want to go there next.
Excellent. Thank you. Yes, would you like to take that question?
Yeah, it's a great comment, really. It's about the need for abortion care in the DRC, where it does remain taboo. As I mentioned, the Democratic Republic of Congo did liberalize abortion about 3 years ago now, and a very interesting process, actually. It was a regional human rights agreement called the Maputo Protocol, which states that abortion is a human right. And the Democratic Republic of Congo had ratified the Maputo Protocol, and therefore it came into force as law, as a national law. So it's so yes, it's legal, but the implementation leaves a lot to be desired. So maybe a handful of people are actually aware that the abortion law has changed. And so now one of the things that we're doing, and Ipas does have an office and a presence in the DRC. And we're working with a range of stakeholders there, including the Ministry of Health, including the Ministry of Justice, Gender, to actually implement the law. And implementation of the law looks like creating technical standards and guidelines for health providers, making sure that people are aware that the law has changed, so that there can actually be safe abortion provided on demand. People can actually ask for these services. And then, and working with especially the very young population in the DRC to inform them about these issues as well. So I just wanted to say to the person who wrote this comment in that you're absolutely right, it is still quite taboo, and we do need to build strong movements there. I think that they are building and growing and moving. And so if you're interested in learning more about what's happening in the DRC, there's actually quite a bit of funding that is going there. And I want to point out that a lot of the funders globally on this issue tend to be the European governmental donors, so bilateral donors, Sweden in particular. But if this person is interested in learning more, I'd be happy to put them in touch with our colleagues in country.
Great, thank you so much for that. I think one of the other questions here that that I'm seeing here is around the kind of public support and awareness. I think one of the things that I've seen that when you're talking about abortion access or reproductive health, there's kind of a natural recoil that's happened. Even in the DRC, the stigma that's attached to it and all of that. It seems like public awareness and support sometimes shifts when talking about, well, would you support a woman, who you knew? Would you support your sister, daughter, if you knew that this would save their, and when you start to shift it into a personal, there seems to be a shift around kind of the theoretical of what this is and really personalizing what it means to have access to the full spectrum of reproductive care. And I'm wondering if either one of you would like to take that question around what's kind of being done or what your organizations are doing, or where funders can step in to help bring in that public support and awareness of these issues.
Some of the work that Ivy Black Girl has been doing with bringing awareness, through our website, through our meetings and sessions with legislators, our public webinars and educational events, and providing resources just to share the stories as well of Black women in Nebraska and their birthing experiences. I've seen this topic get more press in the media, but there are still quite a few people who don't recognize what the disparities are. And, some of the issues that we're facing is, when it comes to parenting, Black women are twice as likely to experience infertility compared to white women, but they're only half as likely to actually get the treatment they need to address infertility. They're 3 to 4 times more likely to die from pregnancy-related causes compared to white women. And then looking at severe maternal morbidity, which is, they didn't die, but they still experienced an unexpected outcome that significantly has significant consequences to their health. They're 2 times more likely to have those types of severe morbidity events. And so, and there are a lot of reasons, people have tried to blame the individual. Well, they're not living the way they should. They're not doing the healthy practices they should. They're coming in with chronic diseases. But we have realized that it's not about the individual. It's not about skin color. So it's not that Black women, just by being Black, are higher risk just by genetics. But it's really that lived experience of being Black in the United States. There's a term called weathering, where by dealing with a lifetime of oppression and racism, it actually ages Black women prematurely. So when they go into become pregnant and experience labor and delivery that are already stressful events anyway for anyone, their bodies are dealing with it at an older, more prematurely older stage compared to those who have not experienced the same level of oppression or discrimination. So being aware of that, I think, should also help funders realize the importance of the intersectional approach to reproductive justice, because you can't just go in trying to address it from a clinical perspective. You have to address all these life and social issues that are contributing and impacting health outcomes, and also potential bias that sometimes happen in the healthcare. So we come to the healthcare system to get help, and that's sometimes the place where we are mistreated the most.
Thank you for that. I think that answers somewhat the question around the urgency of what's happening in the U.S., the research you're talking about for Black maternal health and all the range of different impacts. And so I guess the question is, how can we get this country to award more money towards that? What are some of the compelling cases that you see around kind of just, again, moving more dollars to this issue and seeing it as, yes, it's long term to solve, but there also is an urgency that can't be ignored as well.
Yeah, I think it's, it's an urgency for Black communities, but also the urgency for the U.S. as a whole. Maternal infant health is the pulse for community health. And so when you see that, the birthing persons and the infants are dying at a higher rate or having worse health outcomes, that has long-term impact for the whole community. So this is really a whole community, a whole country issue and a crisis, and that by addressing one group, you're having an impact on the whole community as a whole. It's not just about us, but we're all interconnected. And so when you address the disparities and the bias towards Black birthing persons, that in turn improves the environment and the healthcare for everyone else as well.
Mm-hmm. Thank you. I knew as we're rounding out the last 5 minutes of this conversation, which is so rich. Again, it's so many different aspects to think about. What for you are kind of the biggest opportunities for funders who are interested in supporting and collaborating? Where do you see some of the policy issues, maybe that as their funding policy and their funding organizations to work on? What are some of those the biggest opportunities and takeaways for you?
It's a great question. I think there's a real opportunity right now with the Helms Amendment in Congress, and Ipas has introduced a bill with co-sponsors to repeal the Helms Amendment. And as I mentioned earlier, we've actually have have had some success with this already. We have over 100 congressional co-sponsors of the bill and are looking to introduce it into a vote. So, given that we have this positive administration right now, I think we have a real chance of actually, to at least have the conversation. One of the things you mentioned, Elizabeth, in your question was around norms and polling and what people think about it. Well, we actually did some polling on the Helms Amendment in the US, and we found that most Americans have never heard of it because it's just been part of their lives, part of the normalcy of foreign assistance for so long that people actually haven't heard of it. However, when you tell them this is what it is, it constrains US funding for abortion care and, et cetera, they don't like it. They don't like it, and they would like to see it changed. So I think we have a huge opportunity here to actually inform the Americans about what the Helms Amendment is, do some work to actually explain what the impact is. I mean, do Americans really fully understand that their votes, for Congress, for a president, result in millions of women suffering and dying needlessly because of this bill? Is that something that they really want and support? They don't. They don't. And so, thinking through some of the consequences of what it means to be an American and the responsibility of that. It's a big responsibility to be American. It's not just you're electing your local official or, you're electing somebody who is going to have an impact on the planet. And so we have to take that quite seriously. So I think that's a huge opportunity right now. I also want to mention that, one of the things that Ipas has done a lot of, and I think we could do more of, and I'm saying this in response to some of the chat that I see, particularly from Rosemary about Kenya, is work at the community level. And I'm reminded of my visit to Kenya actually a few years ago, before the pandemic, of course, when I was able to visit and work with or visit some of the work that we've been doing with community partners, particularly faith-based leaders. And in a church, in a local part in Kisumu, I was able to actually go and meet with elders and community leaders and young people who were all together thinking and problem solving about why are women dying from unsafe abortion. As Rosemary points out, 5,000 women lost their lives due to unsafe abortion in the country. All right, so why? The question is why. And so what I saw this group do together, intergenerational group is to kind of problem solve, to do a root cause analysis of, okay, what's happening? Why is this occurring? What can we do? And, they basically identify that stigma, which is part of what you were saying, stigma is at the root of this. And if we actually were able to talk about this openly, we could get the people the care that they need and save their lives. It's kind of frankly just that simple in some ways. And we see that, in Kenya, we see that in Bolivia, in India, in other parts where we work. So I think more of that kind of community activism, the linking of movements together to really bring forward this movement. And then the final opportunity that I want to mention is kind of something I said in the beginning. The US is part of the planet, and I think sharing experiences between what happens in the US and what happens overseas and vice versa is really important. The US feminist movement and movements in general have a lot to learn from what's happened in other parts of the world. And those movements have a lot to learn from the US as well. And I think that kind of exchange could be hugely positive and effective, but there is no money for that. There are no resources available for anybody to do any kind of exchange. It's just not there. So investment in learning.
Thank you so much. We unfortunately are at time, and it's just, again, with such a rich conversation. There are several questions in the Q&A as well, and we will definitely get you a response to that and put that out as our follow-up email. Again, thank you so much, Anu and Christian, for your expert conversation today and your experiences and your thoughts about this critically important issue. I think what's coming away most strongly is that this is a huge opportunity for gender justice funders and for women's funds to fill a much needed gap of making resources available to connect all the different movements together to focus on an issue that is impacting women all over the world and can have a tremendous impact on their economic security and safety and for the future of their community. So again, it just seems like a tremendous opportunity, and they should definitely be in touch with you to learn more. And then we'll follow up with an email with all of the different questions answered and additional resources. So again, thank you again so much for being with us, and thank you all. Thank you all for joining us today. Thank you again.
Bye. Thanks all. Appreciate it.
Thank you.